For years now, the University of Virginia's Counseling and Psychological Services, also referred to as CAPS, has struggled to provide UVA students with timely mental health support. Students have historically had to wait upwards of a month to even get their initial appointment with CAPS. To address this issue, UVA's CAPS has now added a new form of free 24/7 mental health support called TimelyCare. This resource is now allowing all UVA students with or without health insurance to access psychiatric care, counseling visits, and on-demand mental health resources that can be accessed at any time. Dr. Ruzek, the director of CAPS at UVA, explained to us how for the past 10 years, more and more students have been seeking mental health support.
There's always been a high demand for mental health services, at least at my time, since my time at UVA, which has been about 10 years. Every year it seemed that demand for services was increasing.
The large demand present for mental health resources at UVA has made it extremely difficult for CAPS to provide appointments to students in a timely fashion. Rather than having to wait upwards of a month for a CAPS appointment, UVA students can now receive mental health support through TimelyCare in a matter of minutes. This has allowed CAPS's historically long wait times to be significantly reduced.
And for the first time in spring, actually, we started to see a decline in our wait times. For years, it's been, increased wait times, and a lot of students have talked about that, and we've tried to address that in a number of different ways. But like I said, this last spring, we saw wait times. I'd have to look at the numbers to get an exact figure, but it seemed like they were almost cut in half just based on what we were starting to observe.
Saley Fakorzi, the Director of Mental Health Operations for Timely MD, spoke to us about how one of TimelyCare's major advantages is its ability to meet college students wherever and whenever.
Our support comes from our providers being available at all times. Crisis usually doesn't happen during a 9-to-5 work hour. It's that just doesn't happen. Being able to schedule a counseling session at 11 o'clock at night, if that's when you get off of work, is unique.
In addition to providing faster support, TimelyCare services are included in UVA's comprehensive health fee. This means that all UVA students, whether they have health insurance or not, can access TimelyCare at no additional cost. Another large benefit to TimelyCare is the diversity of providers available on the platform.
Probably one of the greatest benefits has been the types of providers that TimelyCare has on their platform. Now there's over 60 providers within Virginia, and most of those providers are providers of color, so students of color who are seeking individuals who have a similar background to them have really good access to those providers. There's also a lot of providers with LGBTQ+ specialization and other specializations, so it's really broadened the type of providers that UVA students can have access to.
We spoke to Nicole Cheng, a rising second year, about her experience using TimelyCare this past spring.
So I was experiencing a lot of social anxiety and a lot of stress just with the transition in college. I just wanted to get a professional's perspective about these feelings that I was experiencing, and just figuring out ways on how to cope with my mental struggle. I really recommend TimelyCare, especially since they helped me a lot with dealing with the personal struggles that I was going through.
There are some aspects of TimelyCare which have room for improvement. For example, there is a limit on the amount of counseling visits UVA students can currently schedule. Let's say someone has used all of their counseling visits and maybe they're seeking to schedule more with a specific therapist. Do they have the ability to do that once they've reached those 12 sessions?
We are now making that available, so that's something that's very close on the horizon. Our program was so focused in the beginning on just breaking down the barriers to the access of care, but there is a cap to the scheduled counseling sessions, and when they do run out, what we do is proactively reach out to the counseling center and make sure that we have provided them with options within the community.
Students may also dislike the virtual format of the platform, wishing to receive in-person support instead. However, some students may actually appreciate the flexibility the online format provides.
The person I spoke to, she was very accommodating with my schedule. And again, they have the video call feature, so it's not like you have to travel to a specific office and like speak with a therapist. And I know some people personally like the in-person, like face-to-face interaction, but overall I think the video call is just as effective as well.
Although it should be an expectation that students not have to wait a month for mental health support when they need it, this does not negate the large advancement CAPS has made with cutting down on wait times and providing students with 24/7 care. Now all UVA students will be able to access mental health support in a timely fashion. For WUVA, I'm Sophia Celentano.